Therapy, well, you know your kid needs an assessment, first of all. It first starts with an evaluation or assessment, and then that determines whether the child might need therapy. So if you're worried about your child, if they're a baby, some of the red flags that you're looking for are stress, that you're stressed about their eating, that the baby seems stressed around meal times, that this isn't really an enjoyable experience for anyone. We don't want that emotion to go on for too long because that can really create feeding problems and an impact on the feeding relationship between you and your child. Other red flags for babies would be difficulty with the suck, swallow, breathe coordination, difficulties with latch. That's when a lactation consultant would come in, difficulties with coordination on the bottle. When they move to solid foods, if they linger on purees past the age of 9 months, they absolutely need feeding therapy because that represents a 3-month delay in development. Most babies will be introduced to purees right around 6 months, and they should get the hang of it within about 2 or 3 weeks. But if they don't, and they're lingering there at 9 months, and even if they're good at it, but they're not moving on to other handheld self-feeding foods, then that represents a 3-month delay, which is a third of their lifetime. Other red flags would be for an infant is that by 12 months, they're not taking any self-feeding foods at all, not even a cracker, not even purees off a spoon. I shouldn't even say that. That should happen, as I said before, by 9 months. For kids who are 1 year, 12 months to 24 months, even 18 months, if those kids seem stalled and you just don't feel like they make progress, or they gag a lot, not just a little bit of gagging, but frequently throughout the day, or they turn their head away from the spoon, or they don't seem to want to develop hunger, they're super picky, they don't like to get messy, all of those can be red flags. For older kids, really it's more a matter of stall in development. So even if the kid is only eating 3 or 4 foods, that means that they have a feeding delay. And feeding is developmental. And I always say this, everybody's heard me say it a million times, but it's just so true, that feeding is like learning to crawl, walk, run. It's a developmental process, just like motor skills, because it is a motor skill. It's a fine motor skill. So those are some signs for younger kids. One of the biggest red flags, though, is caused by this tendency for other professionals to just tell parents to, let's wait and see. All kids are picky. Well, in fact, more kids have feeding delays than we realize, and it's always important to get an assessment. So ways that you can do that are to, if you have a child birth to 3, you contact your local school district and just tell them you have concerns about your baby's feeding development. And no matter, as long as they're birth to 3, they'll give them, typically it's a free evaluation. It can sometimes vary from state to state, but very low cost to free. And then the treatment is also low cost to free. And you qualify depending on the delay. But a lot of insurance will cover a feeding assessment as well, as do special clinics that focus on feeding development, just because they want to help screen those kids and get that child help.